All right, we now take you live to Geneva, Switzerland, as promised, where the World Health Organization is giving an update on COVID-19 pandemic. Dr. Tedros already speaking at this time. Let's take you there now.
However, we also see increasing numbers of cases in Africa, Eastern Europe, Central Asia, and the Middle East. Even in countries that have demonstrated the ability to suppress transmission, countries must stay alert to the possibility of resurgence. Last week, China reported a new cluster of cases in Beijing after more than 50 days without a case in that city. More than 100 cases have now been confirmed. The origin and extent of the outbreak are being investigated. Despite the ongoing global response to the COVID-19 pandemic, we cannot lose sight of other significant public health issues, including influenza. Influenza affects every country every year and takes its own deadly toll. As we enter the Southern Hemisphere influenza season and begin planning for the Northern Hemisphere season, we must ensure that influenza remains a top priority. Co-circulation of COVID-19 and influenza can worsen the impact on healthcare systems that are already overwhelmed. More than 500 million people are vaccinated against flu every year, based on recommendations from WHO on the composition of flu vaccines. These recommendations are based on data and virus samples collected and analyzed by WHO's Global Influenza Surveillance and Response System, or GISRIS. The GISRIS system has been functioning since 1952, and I would like to thank the more than 125 countries that participate in it. Over the past 8 years, significant strengthening of the system has been made possible through the Pandemic Influenza Preparedness Framework. And I would also like to thank the public and private sector partners that participate in this global system. The infrastructure, people, skills, and experience built up through GISRIS, WHO collaborating centers, and national influenza centers have been the foundation for detecting COVID-19. However, this well-established system is now seeing significant challenges. Influenza surveillance has either been suspended or is declining in many countries, and there has been a sharp decline in sharing of influenza information and viruses because of the COVID-19 pandemic. Compared with the last 3 years, we have seen a dramatic decrease in the number of specimens tested for influenza globally. We have also seen a 62% decrease in the number of virus shipments to WHO collaborating centers and a 94% decrease in the number of influenza viruses with genetic sequence data uploaded to the GISAID database. These decreases are due to a combination of issues, including the repurposing of staff and supplies, overburdened laboratories, and transport restrictions. These disruptions may have short and long-term effects, such as loss of capacities to detect and report new influenza viruses with pandemic potential. As many of you know, twice a year, WHO convenes a group of experts who together analyze the circulating flu strains. Based on their analysis, they select the viruses that should be targeted by flu vaccines for the upcoming season in each hemisphere. To know which viruses are circulating, WHO relies on information from countries reported through GISRIS, which we use to make recommendations for the composition of influenza vaccines. This will help us to prevent more severe cases of flu and more deaths. WHO has published guidance on how to integrate surveillance for COVID-19 into routine influenza surveillance as an efficient way to track both of these important respiratory viruses. This is not only cost-effective, it's also essential for protecting the world against the next flu season. The Southern Hemisphere flu season is already underway. There is no time to lose. I thank you.
Many thanks, Dr. Tedros. As I have announced, we have Dr. Wenqing Zhang with us, who is Director of Global Influenza Program. If you would like to get to know more about this important topic that Dr. Tedros has just mentioned. We will now open the floor to questions. I will ask journalists to be short and concise and have only one question per person. So we will start with Brazil. We have Guillermo Bianchini from Estadão online. Guillermo, if you can just unmute yourself. Hello?
Hello?
Yes, we can hear you.
Oh, okay. So my question is about Brazil. I want to know if Brazil can be considered the new epicenter of the COVID-19.
Thank you, Guillermo. If I understand well, the question was, should we consider Brazil as a new epicenter of COVID-19?
I think we said a number of weeks ago that Central and South America, the Americas in general, were very much the hotspot regionally for numbers around the world. But as we've seen also in the last number of days and weeks, other areas of the world have started to have large increases in cases. But Brazil cannot be singled out in the Americas. There are many other countries in the Americas, like Mexico, Chile, and others, who've had significant increases in cases and continue to have an upswinging epidemic. So I would characterize the situation in Central and South America as being of concern. And currently our American...
All right, let's come out of that briefing so that we can get you your weather report. Dr. Tedros, the Director of the World Health Organization, updating on COVID-19, talking about the decline in showing of sharing, of essential influenza information throughout the world due to the coronavirus pandemic. So really a domino effect, really, that we're seeing then at this time. Let's get your weather details.